Welcome to Community Matters. My name is John G. Ananth, and today I have some very special guests with me. I have Archana Sunil. She is a health and Medicare insurance advisor with 5 years of experience. She's an active community member. She's a mom of an 18 and 13-year-old, very big credential. She speaks several Indian languages, 4 in fact, and she's very experienced in helping immigrants navigate healthcare, individual healthcare, and Medicare. I also have with me a man who really doesn't need much introduction to many of you. His name is Dr. Harvey Claremont. He's a general and vascular surgeon from Harvard Medical School. He did his residency at the University of Rochester. He's a veteran of the U.S. Navy. And here in Shrewsbury, he founded the organization Change and the free medical service at the St. Anne's Church. He has 10 children, 3 of whom are natural and 7 are adopted. He's interested currently in senior affairs. Archana, Dr. Claremont, thank you for joining us.
Thank you.
Archana, let me start with you because, of course, seniors hold a very special place in my heart.
Mm-hmm.
They are a very large part of our town, and many of them have built our town. They are pillars in our community. One thing that's important for all of us to know is more about the healthcare situation.
Right.
And so I was hoping that perhaps you can share with us some of the things that we might be surprised to hear.
About senior health care, so you're talking more Medicare, right?
Yes.
So a few things that catches people by surprise is Part A, the deductible. So very few seniors, they've signed up for Medicare A and B, but are not aware that Part A also has a deductible that goes with it. And the benefit period for Part A is 60 days. And so that deductible kicks in every time you go into the hospital. That's separated by 60 days for unrelated events. And that catches them by surprise. So that's one.
How much is that?
$1,364 for 2019.
60 days. That means if you leave the hospital, you come back after 60 days, you got to pay again?
Yes, if it's an unrelated event.
So you could be paying like $1,000
yes, you could be going in and out, yeah. And the other thing they forget to pay attention to is Part B comes with a 20% coinsurance after they've met their annual deductible. And that 20%, and there's no cap on this, that's 20%. Yeah, and so that's something that also catches them by surprise.
So if somebody's going to see the Juilliard-trained general surgeon, and not you, but let's say somebody's charging $300 or something.
You'll be paying 20% of that.
After you pay your deductible,
Correct.
You could be paying 20% of whatever the charges are.
Whatever the charges are, correct. Yeah.
In Part B Medicare.
Of course, it's Medicare contracted rates, but it's 20% of that. Yeah, that's one. And the donut hole is another thing that, when people sign up for it, they hear about it, they're like, yeah, but when they actually hit the donut hole is when they realize what it is. So it's good for them to be aware of all these numbers and when they play in and what roles they play.
Okay, the donut hole, for those of us who are uninitiated.
The donut hole, I have a little cheat sheet here. So with any kind of prescription drug plan, you meet your deductible, and then you start paying your copays. And then when what you pay as copay and then what your insurance company pays, when all of that adds up to say $38.20 for this year, you have reached your initial coverage limit. Yeah. And then you continue on and you've entered the donut hole once you've reached the initial coverage limit. And in the donut hole, you typically pay a little bit more for your generic drugs, 37% for generic and 25% for brand name when you're in the donut hole. Now that hole is being narrowed down for 2020, and it's 25% for both generic and brand name in 2020. But again, so we meet the deductible, then you've met the initial coverage limit, that number I told you, $38.20, and then you're in the donut hole, and you stay in the donut hole until what you've paid for all your drugs and what the insurance company has paid for all your drugs, all of that adds up to $5,100. And once you've reached $5,100, you enter the catastrophic phase where you get some relief, and at that point, most drugs are between $3 and $9.
All right, so basically you have to pay some amount of money. Once you get into the donut hole, we're talking about percentages, but if you pay up to 5,000
100 for 2019.
100, then it's going to be negligible.
You get relief. And now you have to remember, not everybody is going to enter the donut hole. It really depends on what prescriptions you have, how long your list is, and what kinds of medications. Yeah.
All right, now here's something that a lot of seniors want to know about. Medicare Part C.
Yes. So Medicare Part C is also called Medicare Advantage, and at the minimum they have to cover A and B, and a lot of them will include benefits that are over and beyond what Medicare covers, like they have dental, vision, free gym memberships, hearing aids, so some additional perks and benefits over and above the minimum required coverage by Medicare. They range in various premiums from zero premium to $100, $200 a month. And so what they help, the most important feature in my opinion with Medicare Advantage plans is it sets a cap on how much you spend out of your pocket. Because all of these Medicare Advantage plans are required to have a maximum out of pocket, which you don't have with original Medicare. Okay. And it's typically $6,500 to $6,700 per year.
One of the things that really gets me, and Dr. Claremont, I'm sure you can attest to this, is how complicated the system is.
Isn't it ridiculous? It really is.
Isn't it
crazy? Because I deal with people who deal with the ridiculousness of the whole thing. In other words, the people who are in the donut hole, for example, they can't afford their meds. I try to help them out. People who lost their insurance or maybe lost their primary care doctor so they can't get their prescription refilled or whatever. And that is much more common than you think. Yeah. Doctors are leaving their plans all the time. For example, I myself have had 4 separate primary care doctors in 3 years.
Oh, wow.
And I'm a physician, but they leave, or their plan drops them, or they drop the plan. And so, in other words, the doctors don't really have control over the system anymore. They totally obliterated their control, which is really a sad situation. So I deal with the people who either don't have insurance or are underinsured, which means that they're paying 15% or so of all of what they're generating in medicine. All of that, that's the people I deal with.
Wow. And you have some very inspiring stories we'll get into.
We can get into a lot of great stories. A lot of people mention this poor guy who used to be walking up and down. He loved to walk. He walked up and down the bridge every day. He had a huge tumor on his neck. And he used to carry it almost like a basketball on his neck. So the doctors who would drive past to go to UMass, they would stop by. Listen, come on over and see me. We can take care of that. No, I don't want to do anything like that. So finally, he showed up one night at St. Anne's Free Medical. He said, I promised my mother before she died that I'd have this thing taken off. I need to have it taken off. I don't have any insurance. So I made arrangements at St. Vincent's, and I did it myself. I took it off for him.
Wow.
And the guy now walks. He still walks. Nobody recognizes him anymore because he doesn't have the basketball on his shoulder, But that's just one of many, many different types of situations that we run into like that.
That's fascinating. And you really have helped so many people in your practice.
So many, and it's gratifying. It really is, especially when they recognize you later, now that I've retired. And I remember you,
Right.
you helped me out, which is very gratifying. It really is.
Absolutely. Archana, one of the things that is kind of interesting about how the two of you, where you intersect, is you can see from a practical perspective and your work with free patients what it's like when you don't have access to coverage. But Archana, what you are experiencing is when people are covered,
right,
and they're still hit with crazy bills. So what has your experience been like in terms of what is the most important thing that seniors need to know when they enroll for Medicare?
The most important thing to know is that when you're on just original Medicare, which is A and B, that you're exposing yourself to a lot of risk because there is no upper cap on how much you'll be spending out of your pocket. So it's very important to not just stop with A and B and to look into other options such as Medicare supplement plans or Medicare Advantage plans, and they both come with pros and cons. Neither is perfect for everybody, but look into those options because those help reduce your financial risk.
What is the key difference to know between a Medicare supplement plan versus a Medicare Advantage plan?
I could do a whole hour on this, but I won't. Two key differences are Medicare supplement plans offer you the flexibility of seeing any doctor in the entire country that is contracted with Medicare. So there's no network. So it gives you that flexibility. And but they do not cover prescription drugs or dental or vision and all of those things. On the flip side, Medicare Advantage plans do come with networks, some HMOs, some PPOs with varied flexibility, and the majority of them will include dental and vision and prescription and gym membership. Some of them offer international travel reimbursements, so different combinations. So these are the two primary differences.
But you also have to see people, the doctors who are in the plan.
That's the network. Yes.
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 You have
I mean,
to
you
see
pay
them.
less. With HMOs, you have no out-of-network benefits. PPOs will let you see a doctor of your choice, and if that doctor is still in their network, you pay less. If you happen to want to see a doctor that's not in their network, you can still see them, but you'll just pay more to see them. Yeah, so there are all these options to consider.
What you're saying, doctor, is that when let's say you have one of those plans with a network,
Yeah.
if you leave the state, if you go traveling to see your grandkids or something like that, and you're in one of those Advantage plans,
HMOs, you mean?
Yeah, those doctors may not take
Well, if it's an
if they're
HMO,
not
yes.
in network, right?
If it's an HMO, you're out of luck, but emergency is always covered.
Okay.
Emergency anywhere, they're required to cover it. With PPOs, and that's the whole point of the PPOs, you have a network that's outside of your service area, so you can see, I mean, I could have a PPO plan here in Massachusetts and travel to Seattle and see another doctor there that's in the network of the plan I am, as long as it's a PPO. So that's why there are so many things to consider. It's important to talk to a Medicare advisor such as myself so that they can evaluate all your options for you.
Yeah, that's very important. It sounds so complicated. It seems kind of intuitive to ask somebody for help. Dr. Claremont, when you worked at the free clinic, and I know you and I had some experience. I actually was your student, and it was nice. Now Archana doesn't know this, but you are a super doctor. There are doctors, and then there are...
Well, you know,
Super
back
doctors.
then, when we took our residency, I did surgery, obviously, and I did vascular surgery, but we also got trained to do primary care.
Oh, okay.
So after I finished and kind of resigned doing surgery, I did primary care. And I did that for about, I'd say about 15 years before I finally retired. So, yeah, I did that, and that's why I could do the free clinics. Because most of the things there were not surgical, obviously.
Right.
And so
Primary care.
I could function as a primary
That's
care
fantastic.
doctor there.
I did not know that.
Wow.
The other thing, too, is that other of my age, instead of just retiring completely, they take jobs with insurance companies. And when you have to get, say, prior approval for
Right.
something, and that's a big deal now, prior approval for a lot of different things.
Correct.
It's usually the seniors who are making those decisions have no idea, never saw you, don't know anything about you, and a primary care doctor submits something to them, and they just go by the book, basically.
Right.
Nope, can't do that. That's a big issue, and it's part of one of the biggest debates on all these democratic debates that you're seeing now. Prior approval. The conditions that are pre-existing. All these things. Part of it was actually part of Obamacare. He did address those in his, but there's still an issue.
Yes.
Yeah, the pre-existing has been addressed. The prior authorization is still something that needs to be addressed, yeah.
Yes.
Yes, it is.
Yeah.
Quite fascinating. And I remember one time I was sitting with you, and you were telling me about one of your experiences as a surgeon. I found it so fascinating to hear about your most interesting case.
I don't know. There's so darn many interesting cases that I'm not even sure which one we talked about, tell you the truth. You know, over the course of years, I was up to maybe doing 600 or so cases a year when I was really busy at the Fallon Clinic. And that was for a number of years.
Wow.
So obviously, every case is interesting.
Yes.
And that's why I love surgery. Yeah. That's why I like medicine. Every case is different. Every patient is unique. I don't care what your coverage is. I don't really look into any of that stuff. Just like if they came to St. Anne's, we never asked them if they had insurance or not. They needed something. We hopefully, if we had it, we gave it to them. So, you know, that's basically the way that I functioned anyway.
You know, one thing I noticed about you is you are probably coming from a culture of medicine where there's a very patient-centric focus, regardless of insurance, and also a primary care focus where whatever specialty you happen to be in, you were always a regular doctor first.
Right. One of the papers that I will always remember, and I talk about it frequently, it was written by Francis Peabody. He was a physician in Boston, and he actually wrote this address to a graduating Harvard Med class. This was back in the 1928, I believe. And they published it in the New England Journal, published it in the JAMA, the Journal of the American Medical Association. Care of the patient. And basically, it was the art of medicine, which right now is totally gone. Science taken over, totally taken over. No art anymore. You come in, you get a CAT scan, bang, you know, let the radiologist diagnose it. Of course, that drives up the cost of health care.
It does.
You know, most of the people don't even need to have that.
They used to joke, right, that nowadays they make them crawl through the CT scanner before they enter the ER.
Exactly, practically. It's practically the truth, you know. But, you know, it's interesting, we talked even before we started, we talked about what the other debates are now on the presidential election, which is the biggest deal, you know. And they're talking about changing the whole healthcare system. And every president seems to want to have their name on it, like Obamacare, Trumpcare. They all want to have their name on it for their legacy, I believe, not for anything, no other reason. You know, but now they're talking about Medicare for all. They want to have Medicare for everybody. You can call it what you want, universal health care, Medicare for all, whatever. But the only one who really has a plan is Bernie Sanders. And of course, Elizabeth Warren now is on that same bandwagon. She agrees with Bernie. That's all she said. She agrees with Bernie. And poor Joe Biden, he doesn't really know where he's at right now. And so,
it's brutal.
But this Medicare for all, the biggest thing is you got to listen to the people who are against it. I always listen to both sides before I make up my mind on anything. They tell you that it's going to cost an arm and a leg, billions of dollars to have this program. Well, if you look specifically at what Bernie is proposing, he's not going to have you pay any copays, no deductibles, and he's going to cover everybody. Well, how are you going to pay for all that? You know, there's a certain amount of money coming in with all those little copays, they come up. And the deductibles, they really do count. Well, if you could have a plan that would allow you to still have a copay and a deductible, and if you did have some of there's going to be increased taxes, yes, but not catastrophic. Probably an increased tax the way it should be. It would work. It would work.
One thing that I really find important in that debate, and I know this debate's going to go on, and we don't have much time, but I wanted to bring in Archana because of your experience working with Medicare beneficiaries. Do you find that when you find that you're working with beneficiaries, and it's a complex system, and as you had mentioned, you know, when you have something simple like Medicare for all, it kind of takes a lot of that complexity out of the picture and simplifies things. How do you feel, given your experience working with Medicare patients, would Medicare for all, I mean, is Medicare such a good program where what Dr. Claremont is suggesting is better?
I think so. I think the model that Medicare has, especially with Medicare Advantage, that model I think is a pretty good model. It shifts the burden off from the government and it kind of outsources it to the private companies, and they take on the responsibility and in turn get paid for it, and it's pretty efficient, and yeah.
Okay, well, I got your take on it, and I don't want to go too far off into politics, but I thought I appreciate your perspective, and I definitely appreciate yours. So we touched on the subject. One thing I do want to get out there is how seniors can, the inside story of how Medicare works, and what are the most surprising things about Medicare. And you had mentioned the 60-day, if you...
The Part A deductible,
that
correct.
deductible, you could pay that deductible again.
If you had to,
if you came back after 60 days.
Correct.
There's a 20%,
co-insurance.
Part B co-insurance nobody knows about, seemingly. And there was the donut hole.
Correct.
We talked about. And then the choice plans.
Between supplements and Advantage
supplements
plans,
and choice.
correct.
So I hope that we're going to get some statistics on the screen, and we can talk a little bit about the specific statistics at the end of the show. You can look at it. If people want to find out more about questions that they have about Medicare enrollment, what is the key thing they should do?
Well, Medicare.gov is a very good website. It's very handy dandy, very clean, very well organized. It's a great way to get all the information you want. Or you find somebody like me, a Medicare insurance advisor, and they can do the same thing. They can guide you through but Medicare.gov is a great tool.
What is your email address?
My email is, we'd have to put it on the screen later. It's archana@archanasunil.us.
Nobody's going to
spell
that out.
Yeah, exactly. So we'd have to just write it out.
We should also mention, too, that they can get it from the Shine Counselor at all of the councils
state
on
counselor.
aging.
Correct.
A lot of the Shine Counselors are very experienced in all of the plans. In fact, they meet monthly because the plans change all the time. And so there's some additions, some subtractions, they change. So the Shine Counselors are
Definitely the
probably
Shine
the
Counselors,
one.
yeah.
Yep.
And I do want to tell your audience that, to not just use your Part D by default, because there are some good websites where you can shop compare your medication, like goodrx.com or rxassist.org, where you can punch in your medication and see if it's actually cheaper for you to get it through them versus use your insurance. So there are these little tricks that some, insurance advisors like me can tell people about. But Medicare.gov, the Shine Counselors, all of these guys are good sources. Yeah.
Lately I've been talking at places about dietary supplements, which includes vitamins and all of the different minerals, all these things, row after row after row of these in all of the drugstores. It's amazing the number of dietary supplements that people are taking. And I ask them, well, why are you taking it? Well, I don't know. I feel better. You feel better. Never take something unless you have a specific reason for taking it.
Correct.
All these things were put on the market to fight deficiencies, like say vitamin C for scurvy, vitamin B for beriberi. They were there for a particular reason. If you're just taking these things for the heck of it, and it's amazing, $31 billion a year that the United States people pay for dietary supplements.
That they don't need?
They don't need.
Wow, that's a lot of money.
It's a lot of money.
Wow.
Imagine that in the Medicare system or the healthcare system.
I know.
That's an enormous amount of money.
Yeah, that's a lot of money.
That is crazy.
Yeah.
Like I said, I'm giving a lot of talks. I'm talking to people, trying to convince them that they don't need to take these things. Probiotics now.
Yeah.
Why do you need them?
Can I ask him a question?
Well,
I'm
just kidding. What do we need me here
Since
for?
he's talking about dietary supplements, and we're talking about prevention.
I'm going to go to the restroom.
Okay.
I'm just kidding. Go ahead.
Do you have any thoughts on dairy and its impact on health?
Yes. Well, no question that some people...
She's a vegan.
Well, that's okay.
That's all right.
There's nothing wrong with that.
No, I'm saying that's why the question.
But as we get older, a lot of people do become relatively, or maybe all, lactose deficient too. And so if you're having a problem with your digestive system, you've got to look at what actually is coming out. It's kind of gross, but what's coming out? What's causing it? And very frequently, we're seeing more and more lactose insufficiencies.
No, I
seniors.
mean dairy, how it impacts your overall health.
Oh,
The casein protein in the dairy and
well, you got to have dairy, but in moderation. In moderation. It's like everything else. If you take only certain vegetables, only certain things, you're going to become deficient in what they're producing for you. We're learning all the time about the microbiome in your gut, all of the bacteria in your intestinal tract, how it changes as you age. And we're coming up with new things all the time because they act in symbiosis. And so if you take it in a pill form, you don't get that symbiosis.
True.
Interesting statistic, and okay, don't quote me on this yet, but somebody told me that there are more bacteria in your gut than cells in your body.
Yeah, there is 3 pounds.
No.
If you weigh it, it's 3 pounds of bacteria in your bowel. You know, it's funny because you see people who are
That
on
makes it so appealing.
yeah, clean out your colon. Why clean out my colon? For
Anybody
God's
up for
sake,
dinner after this?
Get rid of all my bacteria. You know.
Oh, that is fascinating. So I just want to close, if we could just share a quick, most important message you have for the people of Shrewsbury. Dr. Claremont, let's start with you.
Well, I think the people in Shrewsbury are, compared to other communities, are probably a little better off. But you got to remember that there are people who are not better off. For example, now in Shrewsbury, I try to do a lot of the things that are designed for people who can't get out of their home. So the exercise programs, we do chair classes, we do stuff for them. We try to cater to the whole community, but don't forget the people who can't afford or who are disabled, who can't get out. So just, you have to be aware of that. And certainly in Shrewsbury, we got over 8,300 seniors, and a lot of them can't do their own thing. So be aware of that.
Important to know. Archana, with the
From an
minute we
insurance
have.
perspective, I want the people of seniors in Shrewsbury to re-evaluate your Medicare plans every year during open enrollment, which is October 15th to December 7th every year. So they have a chance to look at new plans, new coverage, you know, just go through it every year. Don't just have the same plan for many years and not know that there are better things out there. So just be aware and make the time to evaluate your plans every year.
Thank you, Archana. And I want to say, on behalf of myself and Community Matters, thank you, Archana, for joining us
Thank
today.
you for having me.
And thank you, Dr. Claremont, for joining us and for all your community service.
Thank you.
Thank you.
Thank you. And of course, thank you for joining us. And we hope you'll catch up with us next time. And thank you for tuning in to Shrewsbury Media Connection. Until next time, everyone, my name is John G. Thank you.